Have you noticed that many people complain of frequent urination, excessive taste, weight loss, or delayed wound healing? One major cause of this symptom is diabetes mellitus. Diabetes mellitus is a chronic disorder in which the body is unable to properly control blood sugar level. And what happens in the body is that the food is converted to glucose, and insulin helps the glucose to enter into the cells for energy. So in diabetes mellitus, the insulin is either absent or insufficient or ineffective, and the glucose then remain in the blood, leading to high blood sugar. We have three major types of diabetes mellitus. There are others, but the three major is what I'm going to talk about. The first is the type 1 diabetes mellitus, which is usually common in young children and young adults. In this one, the body produces little or no insulin. Patients need insulin for life in type 1 diabetes mellitus. Type 2 diabetes mellitus is common in adults and is related to obesity, poor diet, or physical inactivity. And also, there is insulin resistance with reduced insulin production. While the third one is the gestational diabetes mellitus, which occurs in pregnancy, and it can disappear after delivery of the baby. It also increases the risk of patients coming down with type 2 diabetes mellitus. The risk factors of diabetes mellitus include family history of diabetes, overweight and obesity, physical inactivity, poor diet, increase with age, hypertension, and previous gestational diabetes. So these are the risk factors that have been associated with diabetes mellitus. The symptoms that we're going to see in patients with diabetes mellitus include frequent urination, excessive taste, weight loss, fatigue, blurry vision, and poor wound healing. Yes, they're also at risk of recurrent infection. What are the things that can occur after a long time, um like a patient who had diabetes mellitus over a long time or a short time? So I will call these the complications of diabetes mellitus, and I'm going to divide them into the short term and the long term. So for the short term duration, patient will come down with hypoglycemia as a result of maybe excessive intake of the um, oral hypoglycemic drugs. The patient can also come down with hyperglycemia, especially when the glucose level is not well controlled. The long-term complications that can occur include eye problems, which is blindness, kidney disease, can have nerve damage, where you see them coming down with numbness and foot ulcers. Also have heart disease and stroke, as well as erectile dysfunction. Now, most complications are preventable with good controls. So if you have a good glycemic control, then yes, you will be able to prevent these complications that are listed above. Now, how do we diagnose a patient with diabetes mellitus? So after we get the history that the patients have those things I listed above, which are the signs and symptoms, we then do blood tests, which include the fasting blood glucose. We also do the random blood glucose and the glycated hemoglobin, which give us a 1 to 2 month history of what the glucose level have been. Yes. Then how do we manage this patient? First of all, we do our lifestyle modification. So we advise them to take healthy diet, more of vegetables, and less of sugary things. Then as well as regular physical exercise, at least 30 minutes every day. The weight control. If the patient smokes before now, patient should stop smoking and limit your alcohol intake. The medications will include our oral drugs, like the oral hypoglycemic drugs, then insulin in some cases. And also monitor and check the blood sugar level. How do we prevent diabetes mellitus? By eating healthy, doing exercise regularly, maintaining healthy weight, and regular medical checkup. Yes, so it's advisable that you do your regular medical checkup at least, even if it's twice in a year, or two or more than that if you can. The diabetes mellitus is common, but it's preventable and controllable. Early detection, healthy lifestyle, and proper treatment can help people live long and healthy. Please live long and healthy. Thank you guys. Bye. Please kindly like and comment and subscribe to my YouTube channel. Bye.